It's a hello to the COVID scientists and COVID warriors. It's a good afternoon and a warm welcome to all the speakers and participants. I am Dr. Subhash Hira, a doctor of infectious diseases and a public health scientist. I am moderator of the webinar learning series that is launched by the Global COVID-19 Network. This global network is launched because COVID-19 is a pandemic, and the best way to respond to this pandemic is to bring the global actors together. Thus, Sambodhi Research and Communication Organization, Indian Social Responsibility Network, New Delhi, and the University of Washington, Seattle have co-sponsored this global network to foster South-South collaboration and partnership to share lessons. So as we begin, the world case count of COVID-19 has now recorded over 4.5 million infected people, and just over 320,000 people have lost their lives. That is the fatality rate of 6.5%. I will be brief to recap the third webinar held on 12th May 2020. Honorable Vinay Sahasrabudheji, member of Indian Parliament, spoke last week about Indian responses to the pandemic that included the national lockdown since 21st March. That's about 58 days since 21st March 2020. That flattened the curve of new corona cases and kept a low death rate at around 3%, and of course, several social steps to support livelihood. The locally made testing, diagnostic tests, pharma supplies, and PPE have eased management of cases. Our second speaker, Dr. Por, Deputy Director of Institute of Public Health in Cambodia, spoke of selective lockdown in that country, and it spared the local travel, the local markets, and the restaurants. Early shutdown of international travel actually helped the country to keep the curve of infection flat, and zero cases have happened since late April. Their schools and educational institutions are still closed. Dr. Sarman Singh, well-acclaimed immunologist and microbiologist of India and director of AIMS Bhopal, he spoke on technical knowledge on testing methods and their validity and intermittent shedding of the coronavirus, raising false alarms of reinfection and relapse. He stated that the Ministry of Health had announced that all districts in India will soon be having gene expert tests to diagnose coronavirus infections in all the districts, since gene expert machines and the trained lab staff are already present in districts in India. Patients are now being discharged in India at 10th day of onset of symptoms instead of 14 days. I will take a minute to explain the clinical stages of COVID that occur in 15 to 20% of symptomatic cases, as shown in this slide. The slide on the left shows stage 1, which is the viral response phase. It is during the 0 to 5 days with mild symptoms or illnesses like fever, dry cough, diarrheas, and headache, and shivering, and loss of smell and taste. Stage 2 is the lung phase, that is around 4 to 14 days. And that's the time when illnesses like breathlessness, extra changes, and low oxygen below 94% saturation. And then the stage 3, which is the hyperinflammation phase of a storm that happens due to the hormones called interleukin. It's basically a swelling that happens into the vessels and various organs like the heart, the kidney, the lungs, and produce clots in the vessels and heart failure and stroke, etc. So, with this background, our fourth webinar is today discussing treatment and vaccine development for COVID. So our first speaker is Dr. Prashant Saxena, Head of Critical Care at Max Smart Hospital in Saket in India. He has a first-hand experience managing and treating corona patients. So it's over to you, Dr. Saxena.
So if we have a suspect of COVID in the flu clinic or emergency or OPD, then we have to do the test of the patient. And if the test is positive, then we categorize the patient as mild, mild with risk factors, moderate, severe, and critical on the basis of this chart. Now, a mild patient is a patient who just has fever, cough, and minor symptoms of flu. These patients, as per the Indian guidelines, are eligible for home isolation. You don't have to admit them. But if the mild patient has risk factors like age more than 65, diabetes, hypertension, immunosuppression, transplant, these are the patients whom you would like to observe in the wards. Similarly, we have moderate, severe, and critical patients. Now, these are classified on the basis of increasing severity. Increasing severity means increasing requirement of oxygen, increasing chest X-ray worsening, and increasing involvement of other organs, which may gradually succumb to the COVID infection. So on the basis of these, we have moderate, severe, and critical. Mild and moderate patients can usually be managed in the wards, but as far as the severe and the critically ill patients are concerned, they have to be managed in the intensive care setting. So as a general guide, there are few indications for hospitalization for general interest. I would like to highlight these, that anybody with a COVID infection with a respiratory rate more than 24, saturation coming below 94, confused, drowsy, or a PP is not normal, it is low, or has a comorbidity including age more than 65, cardiovascular disease, diabetes, and chronic lung, liver, or kidney disease. These are the patients who may require hospitalization. Once you have the patient in the hospital, then we do the usual tests which are recommended. Plus, we have a risk stratification, which means we send a few set of parameters which tell us that if these parameters are on a higher level, the patient has a higher risk of developing complications and a higher risk of dying from the disease. These include D-dimers, ferritin, LDH, troponin, and ECG. So these are the basic tests which we do. X-ray is mandatory. You don't have to do a CT scan all the time unless you are suspecting some other illness. So as I told you, mild are the patients who have very mild symptoms. These are the patients as per Indian guidelines who can be monitored at home. And if they are admitted to a hospital because of comorbidity, or if they have a concomitant diabetes or immunosuppressive disease, then you just monitor these patients and they are discharged on the 12th day if the test of COVID is negative, as far as the Indian guidelines are concerned. If the test is not negative, we intend to keep them in the hospital till and repeat the test every 2 days till the test is negative.
Good evening, everybody, once again. And I'm going to talk in the next couple of 15 minutes about the convalescent plasma therapy. So what is this convalescent plasma therapy? Why there's so much of talk going on across the globe that there's what is convalescent plasma therapy and how it can be effective in treating this COVID-19 patient? So it is not a new concept, convalescent plasma. For the last many decades, a trial has been done with this convalescent plasma in many diseases like MERS, SARS, chikungunya, Ebola, some with very good results and some with limited results. So the rationale for this particular treatment that a patient who have that infection, he develops antibodies to that particular infection, and that antibodies will be taken, will be withdrawn from the patient plasma, who is now recovered, and this can be used as for the passively infused into a patient who is already now infected, and thereby it can cause a passive immunization on the patient. There are some studies are available from China, from other countries also, where this convalescent plasma has been attempted in a very selected number of cases and with very encouraging results. This one study which has been done in China, where there's a series of only 4 patients, and including one pregnant woman also there, and they had received this plasma therapy, and all of them recovered eventually. There's another very big study of the 10 affected patient, severely affected patient. This was a study from China. They also found that with the transfusion of 200 ml of this convalescent plasma, that the patient recovered within 3 days, and there is a total disappearance of viremia within 7 days. So this was a really challenging, and this has brought some sort of ray of hope among the medical fraternity to start and see that how this can be used as a treatment modality. If you see the Indian scenario, as of today, the reported case of COVID-19 in India has crossed the 100,000 mark, and more than 3,000 patients has died due to this disease. And there's now more than 57,000 are now active cases of there, and we have 39,000 plus cases who have recovered from this patient. Now our target is this 39,000 patients who have recovered from the COVID-19. They can be a subject for the convalescent plasma donation. So when we go for the convalescent plasma therapy, there are 2 stages. First stage is the recruitment of the plasma donor. Who are the person who can be considered for the donation of this plasma? And second part is where the identification of the COVID-19 patient and who can be eligible to receive this convalescent plasma therapy.
It's a pleasure to be here presenting and also listening to all these excellent presentations. I do think that a vaccine will be the best solution for controlling this pandemic. I think we will live with this disease for a very, very long time, and the way to come back to the way life used to be in 2019, you need to have a vaccine. And there are a lot of vaccines being developed, probably more than 100 different vaccines that are being tried and are currently in different stages of preclinical and clinical development. Some of them shows like early signals of immunogenicity that are very encouraging in using very new technologies. So many different types of vaccine formulations have been tried, like from inactivated virus, viral-like particles, recombinant protein, genetic vaccines, either with DNA or mRNA. That's one of the most advanced examples is a mRNA vaccine. Also nanoparticles and some tableted heat inactivated virus that you basically eat for enteric release of the antigens. And you also have live attenuated vaccines using viral vectors like lentivirus, adenovirus. There is also bacterial vectors like bifidobacterium longum. in a variety of dendritic cell-based vaccines. There are some other vaccines that have been tried that are not exactly or specific for coronavirus. That is the BCG that may have an impact on boosting the overall innate immune response. There is also the passive immunization, like we just heard, the convalescent plasma, monoclonal antibodies, and also T-cell therapies that are being tried. There is already about 20 vaccines entering phase 1 and 31 that are already in a mixed phase 1-2 trial combined. And these are enormous number of vaccines, and the speed that has been developed from prototype to first in human has been extremely reduced.